If you spend even a short time scrolling through social media or browsing health forums, you'll quickly notice a recurring concern among men. Am I big enough? It's often phrased in different ways: longer, thicker, larger. But the underlying worry is the same. Behind the question is usually something more tender than curiosity. It's about confidence, it's about comparison, and for many men, it's about fear that they somehow fall short. In my practice as a urologist, I've seen firsthand how deeply this concern can affect someone's emotional well-being. What may seem like a superficial issue on the surface can, in reality, carry a heavy psychological burden. Some men bring it up casually, almost jokingly. Others hesitate, embarrassed, lowering their voice when they ask. A few are visibly distressed, convinced that their body is abnormal despite medical reassurance. Here's something important to understand from the outset. Dissatisfaction with penile size is extremely common. In fact, large surveys of tens of thousands of heterosexual men have shown that more than half report unhappiness with how their penis looks. Yet when researchers asked their female partners about satisfaction, the vast majority reported being content with their partner's anatomy. That disconnect tells us something powerful. Often, the distress is not rooted in a partner's expectations. It's rooted in internal perception. Part of the problem is the lens through which men are viewing themselves. Pornography, selective imagery in media, and exaggerated marketing claims have significantly distorted what people believe is normal. The bodies most frequently displayed are not representative of the general population. Just as with unrealistic portrayals of female bodies, men are exposed to extreme outliers and begin to measure themselves against them. So what is medically considered average? When researchers analyze global data, the average erect penile length is approximately 5.2 inches, or about 13 centimeters. And like any biological measurement, height, shoe size, or hand span, there is a natural range. Medicine uses something called standard deviation to describe this range, meaning most men fall within a predictable spread above or below the average. Being slightly shorter or longer than the average does not mean something is wrong. It means you are human. There is also a clearly defined medical condition known as micropenis. This term applies when erect length falls significantly below the expected range, generally under about 2.9 inches. Importantly, this is rare, affecting well under 1% of the population. Micropenis is usually linked to hormonal or developmental conditions and is evaluated in childhood or adolescence. Most adult men who worry about size do not fall into this category. They have completely normal anatomy, and yet the anxiety can feel very real. There is even a recognized psychological phenomenon sometimes referred to as small penis anxiety. This doesn't mean the penis is objectively small. It means the individual has a persistent, intrusive preoccupation with the idea that it is inadequate. Some men spend hours each day thinking about it. They may avoid intimacy, locker rooms, dating, or even medical care because of shame. In severe cases, this fixation becomes so overwhelming that it interferes with work, relationships, and daily functioning. Mental health professionals categorize this pattern under body dysmorphic disorder, a condition in which a person becomes consumed by perceived physical flaws that others either don't see or consider minor. I've cared for patients who measure themselves repeatedly, searching for reassurance. Others bring printed screenshots from websites claiming average lengths far beyond what peer-reviewed data supports. A few have admitted that they've considered drastic measures, including traveling abroad for procedures they don't fully understand. That's where things can become dangerous. The internet is filled with bold promises, permanent enlargement, dramatic gains, quick fixes. Unfortunately, many of these claims are not backed by rigorous science. Some are marketed by individuals without medical training. Others are offered in settings where safety standards are unclear. When someone feels insecure or desperate for change, they may be more vulnerable to taking risks they would otherwise avoid. This is why open, evidence-based discussion is so important. Men's health includes emotional health. It includes body image. It includes the right to ask questions without being dismissed or shamed. But it also includes understanding what science actually supports and what it does not. Before we even begin to talk about potential treatments, it's critical to pause and ask a deeper question. What is driving the desire for change? Is it comparison? Is it past criticism from a partner? Is it anxiety about performance? Is it exposure to unrealistic images? Sometimes addressing those underlying factors can dramatically shift how someone feels about their body. I often encourage men to consider this perspective. If more than half of men feel dissatisfied, yet most partners report satisfaction, perhaps the issue is not anatomy, but expectation. Cultural messaging has equated size with masculinity, dominance, and desirability, but those associations are social constructs. not biological truths. The reality is that sexual satisfaction is influenced by many factors: communication, emotional connection, arousal technique, mutual understanding, not simply measurements. Anatomy plays a role, yes, but it is rarely the sole or even primary determinant of intimacy. Still, for men who remain distressed after understanding the data, it's reasonable to explore options carefully and thoughtfully. The key word is carefully, because when it comes to altering a healthy body part, the stakes are high. Some interventions are experimental, some carry long-term complications, and some simply do not work. As we move forward into a deeper discussion of treatments, both non-surgical and surgical, it's essential to keep this foundation in mind. Most men who worry about size are medically normal. Anxiety around size is common and can be intense, and decisions made from a place of fear can have lasting consequences. Understanding the science, the psychology, and the risks empowers you to make informed choices. And sometimes, the most powerful intervention isn't a procedure at all, it's perspective. Once we acknowledge that most men concerned about size fall within the normal anatomical range, the next natural question becomes, what, if anything, can actually change penile length? This is where emotion must give way to evidence. In medicine, especially when we're discussing healthy tissue and elective procedures, we rely heavily on data collected over time under careful supervision to determine what is both safe and effective. It may surprise you to learn that major professional organizations in sexual medicine do not recommend routine penile lengthening procedures for men with normal anatomy. In fact, these interventions are generally considered experimental outside of very specific medical conditions, such as true micropenis. That distinction is important. Wanting change is understandable, but medicine must weigh desire against risk. Before we discuss devices or surgeries, I want to emphasize something that often gets overlooked. Psychological counseling is not a dismissal of the concern, it is treatment. Studies have shown that when men who struggle with persistent size anxiety work with trained mental health professionals, particularly those familiar with body image disorders, a significant number experience meaningful relief. Some ultimately decide they no longer want physical intervention at all. Why does this happen? Because anxiety can magnify perception. When someone becomes preoccupied with a perceived flaw, their brain reinforces that focus repeatedly. Counseling helps interrupt that cycle. Cognitive behavioral therapy, for example, works by identifying distorted thought patterns and replacing them with more balanced interpretations. For a man who spends an hour or more each day thinking about his size, this type of intervention can be transformative. Of course, not every man who seeks information about enlargement has body dysmorphic disorder. Some are simply curious. Others are looking for marginal improvement. So let's talk about non-surgical approaches that have been studied in medical literature. The only non-surgical method with consistent, measurable data supporting modest length gain is penile traction therapy. These devices, often referred to as penile extenders, apply gentle, sustained stretching force to the penis over time. The concept is similar to how orthodontic braces gradually shift teeth or how tissue expanders are used in reconstructive surgery. When tissue is subjected to controlled mechanical tension over prolonged periods, cellular remodeling can occur. In clinical studies, men who use traction devices daily, often for several hours a day over the course of months, experience small but measurable increases in length. On average, the gain was around 2 centimeters, which is less than an inch. That number matters because expectations must be realistic. This is not a dramatic transformation. It is a gradual, incremental change that requires discipline and patience. It's also important to understand how measurements are taken. In urology, we often use what's called stretched flaccid length. This involves measuring the penis while flaccid but gently stretched to its maximum length. Research has shown that stretched flaccid length closely correlates with erect length, making it a reliable clinical measurement. This standardized method reduces variability and allows researchers to compare results accurately. Even with traction therapy, there are limitations. It demands consistency. Skipping days or using the device improperly reduces potential benefit. Some men experience temporary side effects such as mild bruising, skin irritation, or numbness. Most of these issues resolve when the device is used correctly, but they highlight an important principle. Even non-surgical options are not risk-free. You may have also heard about vacuum erection devices being marketed for enlargement. These devices are medically used to help men achieve erections by drawing blood into the penis through negative pressure. While they can be effective for erectile dysfunction, studies have not demonstrated meaningful permanent increases in penile length from vacuum use alone. Any enlargement seen during use is temporary and related to blood engorgement, not structural change. Then there are injectable treatments, which require particularly careful discussion. Various substances, fat, dermal fillers, silicone, and other materials have been injected into the penis in attempts to increase girth or length. While some early cosmetic results may appear promising, long-term complications can be severe. These include infection, scarring, deformity, chronic pain, and even tissue death. Some complications do not appear until years or decades later. As a surgeon, I have seen the aftermath of poorly regulated injections. Removing foreign material from delicate tissue can be complex and sometimes impossible without compromising function. The emotional toll on patients dealing with complications can be profound. For this reason, injectable penile enhancement is not widely recommended within mainstream urology, particularly outside carefully controlled research settings. Now let's address surgical options. One of the most commonly discussed procedures involves releasing the suspensory ligament. This ligament anchors the penis to the pubic bone. By cutting it, more of the internal portion of the penis can project outward, creating the appearance of increased flaccid length. However, this does not increase the actual length of erectile tissue. And because the ligament also contributes to stability during erection, some men experience changes in angle or support. Other surgical techniques have been described, including tissue grafting and more complex reconstructive methods. Unfortunately, outcomes have been inconsistent. Satisfaction rates vary widely, and complication rates are not negligible. Problems can include scarring, infection, erectile dysfunction, and cosmetic dissatisfaction. Additionally, many published studies are small and lack long-term follow-up, making it difficult to draw definitive conclusions about safety and durability. This is why, in medicine, clinical trials matter so much. A properly conducted clinical trial involves oversight by an institutional review board, which ensures that patient safety and ethical standards are upheld. Data is carefully tracked. Complications are documented. Outcomes are measured objectively. Only through this process can we determine whether a procedure should become standard practice. Without that rigorous evaluation, anecdotal success stories can be misleading. A single positive testimonial does not replace scientific evidence gathered from dozens or hundreds of patients over time. So where does this leave us? It leaves us in a place of cautious realism. There is one non-surgical option, traction therapy, that offers small, incremental gains for highly motivated individuals. Surgical procedures exist but carry meaningful risks and are not broadly endorsed for men with normal anatomy. Injections and unregulated treatments can result in serious harm. The deeper question becomes not simply, can this be changed, but should it be changed? That question requires thoughtful reflection, ideally with guidance from qualified medical professionals who understand both the physical and psychological dimensions of the issue. As we move into the final chapter, we'll shift from procedures and data to practical guidance, what men can do to improve confidence, intimacy, and well-being without putting their health at unnecessary risk. After reviewing the science, the devices, and the surgical possibilities, many men arrive at a quieter, more personal question: how do I move forward from here? If there is no dramatic, risk-free solution, what can I actually do to feel better in my own body? This is where the conversation becomes less about centimeters and more about confidence, health, and perspective. First, it helps to return to a simple truth: variation is normal. Human anatomy exists along a spectrum. Just as height or facial features differ from person to person, so does penile size. When we zoom out and look at population-level data rather than curated media images, most men fall well within the typical range. The problem is not biology, it's comparison. Comparison, especially in the age of constant digital exposure, can distort reality. Pornography, selective photography, camera angles, and even surgical enhancement in performers create a visual environment that does not reflect everyday bodies. When that becomes the standard in someone's mind, ordinary anatomy can start to feel inadequate. Recognizing that distortion is often the first step toward relief. I often encourage patients to shift their focus from measurement to function. Is the penis capable of achieving erection? Is there pain? Is there curvature that interferes with intercourse? Is ejaculation occurring normally? If the answer to these questions is yes, no, and yes respectively, then from a medical standpoint, the organ is doing its job. Function matters far more than numerical size. Another important aspect is understanding what truly contributes to sexual satisfaction. Research consistently shows that emotional connection, communication, arousal, and attentiveness are far more influential than anatomy alone. Many partners prioritize intimacy, responsiveness, and mutual pleasure over size. Yet cultural messaging has convinced many men that length equals worth. That equation simply doesn't hold up under scientific scrutiny. For men who remain preoccupied despite reassurance, seeking support from a mental health professional can be life-changing. There is strength in addressing anxiety directly. Therapy does not mean something is wrong with you. It means you are investing in your mental well-being. When intrusive thoughts about size consume hours of the day or interfere with relationships, that is not a minor issue. It deserves care and compassion. In practical terms, there are also ways to optimize appearance and confidence without altering anatomy. Weight management, for example, can make a noticeable difference. Excess fat in the lower abdomen and pubic area can partially obscure the visible portion of the penis. Losing weight does not change true length, but it can improve how much is externally visible. For some men, that alone significantly improves self-perception. Grooming habits can also influence appearance. Trimming pubic hair may create the visual impression of greater length. These adjustments are simple, safe, and reversible. They are not medical treatments, but they can enhance comfort and confidence. Physical health plays a critical role as well. Cardiovascular fitness supports strong blood flow, which directly impacts erectile quality. Conditions like diabetes, hypertension, and smoking-related vascular disease can impair erections, sometimes leading men to misinterpret firmness issues as size issues. Addressing underlying health conditions can improve sexual performance and overall vitality. I've had patients who initially came in asking about enlargement, but ultimately discovered that treating erectile dysfunction, managing anxiety, or improving communication with their partner resolved most of their concerns. Sometimes what we think is a size problem is actually a performance anxiety problem. And performance anxiety can create a cycle. Worry leads to difficulty with erection, which reinforces the belief that something is inadequate. For those considering traction therapy, realistic expectations are essential. Small gains are possible with consistent use over months, but this approach requires patience and medical guidance to minimize risk. It should never feel rushed or desperate. If the motivation is rooted in intense distress, addressing that distress first remains the priority. As for surgical procedures, the decision should never be made lightly. Surgery on a healthy organ carries inherent risks. Scarring, altered sensation, changes in erection angle, and dissatisfaction with cosmetic outcomes are all possibilities. No reputable surgeon will promise dramatic transformation without discussing potential complications. If a provider guarantees dramatic results with minimal risk, that is a red flag. It's also important to protect yourself from unregulated treatments. Traveling to unknown clinics, injecting substances obtained online, or trusting non-licensed practitioners can lead to irreversible damage. The internet is full of persuasive testimonials, but testimonials are not clinical evidence. Once tissue is scarred or infected, restoring normal appearance and function can be extremely difficult. Ultimately, the goal is not perfection. It is well-being. That includes physical health, mental stability, and fulfilling relationships. When someone feels secure in themselves, size becomes far less central to identity. If you are struggling with persistent worry about your body, start by speaking openly with a qualified healthcare professional. Ask questions, request data, share your concerns honestly. You deserve accurate information, not shame. You deserve evidence, not marketing. And perhaps most importantly, you deserve compassion from your doctor and from yourself. There is a powerful shift that happens when men begin to see their bodies not as projects to be fixed, but as parts of themselves worthy of care. That shift reduces anxiety, improves intimacy, and often leads to healthier decisions overall. In the end, while modern medicine can offer limited tools for physical modification, the most meaningful transformation often comes from knowledge and perspective. Understanding what is normal, recognizing unrealistic standards, prioritizing health, and seeking support when anxiety becomes overwhelming. These steps protect both body and mind. Your worth is not measured in inches. It is reflected in how you care for yourself, how you show up in your relationships, and how you safeguard your health. When you approach this topic with informed caution rather than fear, you place yourself in a position of strength, and that, far more than any procedure, is what leads to lasting confidence.